Hello, good afternoon. It's good to see such a wonderful turnout. I think there's a good number of my students in here. Good to see you. So we have our next session, which will include Dr. Shirin Hooshmand. I had very much the pleasure to introduce her. She was my mentor, friend, colleague. She earned her doctoral degree from the Department of Nutrition, Food, and Exercise Sciences from the Florida State University. This is followed by her postdoctoral training at the same institution. She joined the San Diego State University in 2011 as a faculty member, and she currently holds the position of professor of nutrition at SDSU. She's also a registered dietitian. I didn't know that. So wonderful. And her primary research interests include understanding physiological responses to diet and dietary components during normal and pathophysiological states during various stages of the life cycle using clinical interventions as well as preclinical models such as cell culture and animal models. She's also published 70 original articles in peer-reviewed journals and presented more than 120 abstracts at national and international symposia and conferences. In addition to publishing in scientific journals, she's also actively disseminates research findings in formats ranging from scientific presentations and webinars to podcasts and popular press articles. Shirin is recognized for her academic achievements, and she has been honored with the Graduate Women in Science Fellowship, Florida State University Alumni Award, San Diego State University Outstanding Faculty Award, as well as the Graduate Professor of the Year Award and Senate Distinguished Teaching Award. So it is my great honor and pleasure to introduce and give your ears to her, Dr. Shirin Hooshmand. Thank you.
Hi, everyone. It's really a great pleasure to see you all and for you all being here. I know it's late in the afternoon. I hope you're not sleepy and you're up for this session. Thank you so much, Marcus. It is really a pleasure to see him. I haven't seen Marcus forever. So we were at the same time at Florida State University. So it's great to see him. Okay, so I'm going to talk about plant foods. But specifically, I'll focus on one specific plant foods, and I explain to you why I'm focusing on that specific plant food. And I'll also talk about chronic diseases, but in terms of chronic diseases, what I'm trained in and I mostly focus on during my studies are actually this osteoporosis disease that you might be familiar with. So this is a disease that usually is when you have low bone density or the microstructure of the bone is changing. So we see changes happening in our bone density, but that's something we often don't know we are suffering from. So nobody will know they have bone loss until the first symptom of osteoporosis happened, that we call it fracture. So fracture is often known as the first symptom of osteoporosis or bone loss, and that's why we go so often unknown of having this condition until we have fracture. Of course, if we are younger, that's not a big deal. We have fracture and then we can repair. But as we get older, this really become an issue for morbidity, because we often will have fracture when we are older, but the bone will not repair anymore as the way when we are young. So this will really become an issue that we deal with as we are getting older. Currently, 10 million Americans suffer from osteoporosis, 8 million of them being women and 2 million being men. So you can see kind of our posture changes, but that's just something that probably we associated with aging. So we don't think often that this is what's happening in us is really bone density loss. So we say bone density is really important when we talk about osteoporosis or bone loss. And it is because there are studies like this study that shows we reach our peak bone density usually when we are 25 years old. So whatever we do in our life, nutritionally, we are improving our bone density and adding to this bone density until we reach an age that we reach our peak bone density. And then you can see if we reach this, for example, 1.1 gram per centimeter square of the bone mineral density, then we can, throughout life, still we are going to lose those bone mineral density. And sometimes around age 75, we are expecting to have osteoporosis, okay, having the onset of the disease. If we can improve our bone density when we are reaching that peak bone mass, just 10%, and get 1.2 gram per centimeter square, you can see that you can delay the onset of osteoporosis for almost 13 years later. And if you have 10% less bone density, then you are going to end up with osteoporosis 12, 13 years earlier. So that really makes a big difference what you're doing to yourself in terms of bone density and improving your bone density and having higher bone density in order to be able to have osteoporosis later and later in life, because that really changes your life quality as you're older. Okay, so if we look at the diet in general and see what are the different parts and components of our diet and how they are affecting our bone mineral density, you can see that in this study they have looked at different groups of the food that we consume, and wherever you see a higher or like darker gray, you can see there's more association with that food in terms of bone density. So you can see here, for example, fruits and vegetables, fish and seafood are some of those groups that are really good in terms of bone density because there's a strong association with consumption of those groups and bone density. And of course, there are some that there are less association in terms of meat and confectionery. Legumes are also good in terms of bone. So this is a study that looked at specifically different food groups and the association of different food groups that we consume in terms of bone density. There are also many different epidemiological and observational studies that they have looked at the effect of, in general, higher consumption of fruits and vegetables. And higher consumption of fruits and vegetables is associated with higher bone mineral density. This review study actually looked at the specific foods that have been investigated in clinical studies or animal studies or cell culture study further in terms of their bone health effects. So you can see in the picture that, for example, they have apple, grapes, berries, onion, prunes, and tomato as foods or fruits and vegetables that they have been tested in terms of their effect on bone health further in just specific clinical studies or cell culture and animal studies. So usually what we think of why fruits will have effects, fruits and vegetables, will have effect on our bone density is beyond calcium and vitamin D. So you probably always have heard how important is calcium and vitamin D in our diet for our bone health. And that is still the base and is very important. But what we know about fruits and vegetables and their effect on bone health is really beyond that calcium and vitamin D. So what they have seen in these studies is mostly that they can increase antioxidant activity in our body, decrease oxidative stress, and decrease inflammation. They also have seen that these different fruits and vegetables can have direct effect on our bone cells. So you can see there's direct effect on osteoblasts and osteoclasts, and they can affect the production of these cells, so ultimately causing us to have better bone density and bone strength and lower risk of fracture. So this is the review of the different fruits and vegetables that can have effect in terms of bone health for us. Among these fruits and vegetables, I work in the prune area, and so we look at the effect of prunes in bone density, and it is because actually when I joined the graduate program, my advisor was the first person who actually looked at the effect of prunes in terms of bone health. His research was in the area of bone health. Of course, he did a lot of different animal study and human study, and he looked at different fruits and vegetables. But at some point, in 1998, there was a paper published, it's not this study, and I don't have it here, but it was a paper published that a bone scientist looked at the effect of 50 most commonly consumed fruits and vegetables in Europe. And so they find out among those fruits and vegetables, prune was the most effective in terms of bone, and onion was the most effective vegetables in terms of bone health. So my advisor followed up on prune because he was also a dietitian, so he often thought about something that is feasible to later translate it to human studies, and people can consume it. How often can we convince population to consume 1 onion per day, versus having few prunes for a snack per day? So this was the base of how this study started, and this is the first study that was conducted that looked at the effect of prunes in terms of animal bone health. There are 4 groups in this study. One is sham or control group. The other 3 groups are ovarectomized. Ovarectomy means the ovary of the animal has been removed, so these animals don't produce estrogen anymore. They mimic the body of postmenopausal women when they don't produce estrogen and they go through bone loss. So you can see that the ovarectomized group is losing bone density. When they put animals in low dose and high dose of prune, you can see that high dose of prune is able to prevent bone loss in this animal study. This is an amazing finding, but many other fruits and vegetables can do this effect. I often hear blueberries are great for your bone. Yes, they can do exact same thing and they can prevent bone loss in animal studies. Onion is the same, actually soy is the same, strawberries, grapes, so there are many fruits and vegetables that they have this similar effect. What makes prune to be different than other fruits and vegetables is this second study. So if you look here, there are 6 groups in this study. One is the sham or control group, and the other 5 groups have been ovarectomized. In this study, these animals were allowed to lose bone. So after the bone loss was confirmed in these animals, now they were put in different doses of the prune. You can see low, medium, and high dose. In this study, they also had estrogen, which was, at that time, hormone replacement therapy was one of the treatment for bone loss and was considered as positive control in this study. So you can see that even low dose of the prune is able to reverse the bone loss. So this is something that we see only so far with prune, and other fruits and vegetables cannot reverse the bone loss that's already caused. So in this study, they also looked at the microstructure of the bone. Wherever you have darker gray is the more structure of bone available. So you can see in the sham, we have the intact structure. In the ovarectomized group, the structure is lost. And then in different doses of the prune, you can see that the structure is coming back to some degree, even better than what you see in the positive control or estrogen group. So to follow up on those studies, my advisor did a pilot study looking at if we can really translate this from animal studies to human studies. So in this study, they had 60 participants in the study, and they had 2 groups. One, they were receiving prunes or dried plum, whatever you want to call it, daily, 100 grams per day for 3 months. And the other group were receiving dried apple, 75-gram dried apple, kind of like matching in terms of macronutrients that they were receiving. And these postmenopausal women were just postmenopausal. We didn't know if they have osteopenia or bone loss or any other issue. So it was just kind of like pilot study. And as you can see, that prune is able to change some of the bone biomarkers, such as bone-specific alkaline phosphatase and IGF-1, more significantly different than the dried apple group. So after that, we were eager to do a study and look at the long-term effect of prune consumption, because if we are claiming that prune is helping our bone density, we are really interested to see if the bone density is changing or not. So in this 1-year-long study, we looked at postmenopausal women who were confirmed to have osteopenia. So bone loss or osteopenia was confirmed in these postmenopausal women when they started the study. Then we had them in the study for 1 year. There are 2 groups in the study. One are receiving prunes, again, dried plum or prune, 100 grams per day, and the other group is receiving 75 grams of dried apple daily. We measured their bone density using DEXA at baseline and after 12 months, and then we look at their blood and urine markers in 3 months intervals. So you can see here that in all the bone, in all the areas from ulna, spine, femur, and total hip and total body, both groups are showing improvement. So the percent changes in both is positive. But in some areas, prune is doing better than apple. So again, apple is a fruit as well. So apple has positive effects in terms of bone. It's just the fact that prune is showing to be more effective when it's compared to dried apple. And why is this finding so significant? Is because if we look at postmenopausal women in general, if they're not on any hormone replacement therapy or any medication, that's the middle bar you're seeing here. So they often lose 1 to 1.5% bone density every year. If they're on hormone replacement therapy or medication, they have less loss. But postmenopausal women, when they start losing estrogen and they're not on any medication or hormone replacement therapy, again, they lose 1 to 1.5% per year. What we saw in our study was our postmenopausal women who were going to be in the same shoes and they were going to lose 1 to 1.5% bone. They did not lose any further bone, but they were also able to maintain and improve their bone density. So when I joined San Diego State University, I followed up on the same line of the studies. And I was really interested to see, can we go lower than 100 grams per day? Because I work with these participants day to day, and a lot of them complain about 100 grams of prunes is a lot of prune. That's equal like to 10, 12 prunes per day. So my goal was to find, can we really go lower and see the same effect? So I also was trying to get away from the dried apple group because apple is still a fruit, and comparing, fruit with fruit made it harder. So I was trying to go to what's the standard of treatment. So we designed a study that we had 3 groups: calcium and vitamin D, which is the standard of care for postmenopausal women as they are going through osteopenia. So they received calcium, vitamin D daily for 6 months. These were, again, osteopenic postmenopausal women. And then the second group were receiving calcium and vitamin D with 50 grams of prune per day. That's more like 5 to 6 prunes per day. And the last group were receiving 100 grams of prune daily with their calcium and vitamin D. And we had them in the study for 6 months, mostly for reasons that we didn't really have real funding for this study, and it was a pilot study when I started as a faculty. So what we saw was that you can see again in the total body, there are significant changes in 50 gram and 100 gram compared to calcium and vitamin D only group. So we can say from this study that 50 gram of prune is as effective as 100 grams of prune in postmenopausal women to prevent bone loss. Of course, as I said, that was a small study, 6 months study, and we didn't have funding. But another group followed up on our exact design, and they did the exact same study in a larger population with 12 months length of the study. So I'll talk about that in a second. But before that, first they had this publication out that this is just a case study. So it's just one of their subjects, specifically because this study was happening during COVID. So they were trying to, have at least one of the subjects' results out. So this is very interesting. So let's look at what's happening. So again, it's a case study. So you can see the 55 years old postmenopausal woman who was 5 years postmenopause and was 12 months for the study on calcium and vitamin D. So the first 12 months you see in every graph, in every bone area, that part is when they were just on calcium and vitamin D in the study. And then this participant, when she was done in the study for 12 months, was interested to try the prune because wanted to see if prune will improve her bone density. So then she added that 50 grams of prune to her diet. Again, it's just sample of 1, but let's see what's happening. So for the 12 months, this person had 2% loss. And then after that, 16 months when she's on prune, you can see there's 0.5% increase in total body. The same thing we are seeing in the lumbar spine. There's 7.6% loss, and when prune is added, there is 7.8% increase in their bone density in lumbar spine. In the total hip, there's 6.4% loss, and then there's 1% increase after that when they're in the prune, and then we don't see that change really happening in their femoral neck. So they have 6.5% loss, and that loss continues even when we add the prune to their diet. So let's go over the same design of the study you heard, but when they did in a larger sample size, we only had 45 participants. You can see here they have 235 participants. So of course it's great that someone else repeat your study, but with more power and for a longer period of time. And of course I was super excited because they found the exact same finding. So this is the result of that study, and you can see the calcium and vitamin D group lost bone density, but prune group, both 50 gram and 100 gram, almost maintained their bone density. So again, in osteopenic postmenopausal women, this study from Penn State showed similar results as we found that made me really happy. Okay, so we continued this line of the research with prune. because at some point I had a student in the class that they were asking me about the effect of oral contraceptives in terms of bone health. So I become really interested in terms of like what's the effect of oral contraceptives in our bone health, and there are actually like that would be the topic of another talk, that how they're affecting our bone, but there's some evidence that oral contraceptives can also, especially at younger age, can cause bone loss. So let me walk you through this study. So in this study, we had 3 groups. One was people who were not consuming any oral contraceptives, so they were our control group. And then we had 2 groups that participants were on oral contraceptives, but then one group was receiving prunes, so 50 grams of prunes per day. These were 18 to 25 years old young women. So what we find out in this study was in the radius ulna of the arm of our participants, we can see that there's significant changes, and this is happening in people who are not taking oral contraceptive. Their bone density is increasing in ulna, and that's because probably people from age 18 to 25 are still reaching their peak bone mass. So they're still growing, and they're still getting to that highest bone density that they can. What we saw in the oral contraceptive group is there's a little bit decrease, and then, but there wasn't significant changes really. But in the oral contraceptive with prune, again, we see an increase and improvement. So oral contraceptive didn't change the bone density, but when prune was added to their diet, they're again improving that bone density. We can see again in trabecular density that we are seeing significant changes. And the same thing is happening, that oral contraceptive group is showing no significant changes, while the other 2 groups have a little bit changes. Sorry, the oral contraceptive group has the decreased significantly, but the other 2 groups are not showing any changes. So again, we go back to the concept that, remember, prunes are not source of calcium or vitamin D. So the reason that fruits have effect on our bone density is mostly because they're antioxidant properties. So when you look at the prune's antioxidant quality in comparison to other dried fruits, and specifically in comparison to our famous antioxidants such as vitamin C and vitamin E, you can see it's really doing better in terms of antioxidant quality. So if antioxidant is the answer to the bone density, then another group of researchers really looked at different fruits that are known for their antioxidant ability, such as you can see here again, prune, apple, apricot, grape, and mango. So they compare all these different fruits in terms of their bone effects in ovarectomized animals. So you can see the ovarectomy group, they're all again ovarectomized. So this ovarectomy group has a low bone density kind of. And then you can see how prune is improving the bone volume over total volume, where the other groups, even though there are fruits that are high in antioxidant, they're not having the same effect we are seeing with prunes. So again, other fruits with antioxidant are effective, but none of them is really as effective as prune in animal studies when we compare these fruits. And then, at the same time, this group also looked at the antioxidant activity in the blood circulation in serum. And you can see more or less all the groups are showing the same antioxidant activity in circulation. It's just the bone effect is different. So again, it's something more than just antioxidant in the fruits that's playing this role, at least in prune. So looking at the nutrient composition of the prune, something that if you consume 100 grams of prune, again, going back to our studies where we looked at the 100 grams of prune, you can see that you will receive 28% of your dietary fiber, 20% of your potassium, 10% of magnesium, and then you can see really more than half of your requirement of your vitamin K, which is really important for your bone health, 10% vitamin B6, and 31% copper. So one of the things we think is that this mixture of different nutrients in prune can be really effective in terms of improving bone density. So it's not just antioxidant effects that we are seeing, but it could be more than that, and it could be the mixture of different nutrients. If you look at the antioxidant profile of the polyphenols in prune, you can see that prune is really good source of chlorogenic acid and neochlorogenic acid. So those could be also players in terms of bone health. So we talked about rat studies in female, and also a lot of studies that we focus on women. But what about male animal studies? Does prune has the same effect when we look at the male animal study and of course in men? So this is again another study from another group that you can see there are sham, which is the control group, and then there are animals which are orchidectomized, so similar to ovirectomy, but this is in the male animal model. And you can see orchidectomy can cause bone loss, but then different doses of the prune added to their diet is improving their bone density, both at the whole body and different areas such as femur and L4. You're seeing the similar effects from this animal study. So in this study, they also looked at microstructure of the bone, and it was a lot after the first study I showed you. So the microstructure imaging is a lot more advanced in 2007. And then so you can see when they looked at the distal femur and also the vertebra, the changes they're seeing in the control, you can see the structure of the bone is kind of lost. And then adding prune is really restoring that structure that's lost. And then PTH is also one of the treatments for bone loss or osteoporosis. So there are injections of PTH as a treatment for osteoporosis. So again, in this study, this was used as a positive control, and you can see the improvements that you see with prune is very similar to what we see with positive control or PTH, which is a treatment for osteoporosis. So a researcher from UC San Francisco, actually who was not a nutritionist or food scientist, followed up in this line of research because he found the effects of prune on bone health really mesmerizing. So he was just a bone scientist, and he was interested to see, is this really true? So he looked at the effect of prune in young and old mice. So he has 6 to 12 months old mice versus 18 to 24. So this is just like as long as mice live. So it's really old age when you look at the 18 to 25 months of age in mice. And you can see when prune was added to the diet of these animals at different doses, the darkest dose, darkest line is the highest dose. And you can see the highest dose is effective in maintaining and preventing bone loss in both young and old animals, as you can see here. And then the same scientists also looked at the younger animals at different ages at like 1 or 2 or 3 months, and you can see that again different doses of the prune can improve the bone density. So maybe even in younger population, if prune is added to their diet, they can just have higher bone density to start with. So to follow up on this animal study, we conducted a human study for 12 months again, and this time, again, this was kind of like a pilot study because we didn't have any data on men who were tested for their effects of prune on bone. And you can see that we had 2 groups in this study. One were receiving calcium and vitamin D daily, and the other group were receiving calcium, vitamin D, and prunes. And then we had them again for 12 months in the study, looking at their bone density using DEXA, PQCT, different methods of measuring bone density, and also every 3 months checking on their bone biomarkers and urine markers. So in this study, we saw similar finding. I think I have this one breakdown for you too. So you can see that looking at the DEXA and PQCT results in this male study or men study, who were 50 to 79 years men who did not have osteopenia or bone loss. Okay, so these were like some they had, but we really didn't screen based on their bone status. So they were all healthy men in the study. And I'm showing you what we are looking when we talk about 66% tibia. Here's the picture. So you measure the tibia, and the 66% of the tibia is this area of the tibia you're looking at. In the last study I was presenting to you, we were looking at the 4% trabecular in the oral contraceptive users. So you can see when the control group and the prune group is compared, again, you can see there is an improvement after 12 months in their cortical thickness, but also in other areas as well, in the total density in the 66%, and also in the endosteal circumferences, which they all point out to the point that men are still improving their bone density when they're on prune at that age, in 50 to 79 years of age. Okay, so for a little bit, I want to focus in other animal models that other investigators have looked at. So yes, there are bone loss as a result of aging. their bone loss as a result of women go through menopause and lose estrogen, so they have lower bone density. But there are also different reasons in life that we end up with bone density in addition to aging or loss of our hormones. So one of the studies that this is conducted by NASA scientists, and they looked at the effect of radiation. So the radiation is really important, not only just for astronauts, but for patients who they go through radiation therapy, or they radiation workers, and again, astronauts. I know they're a small percentage of the population, but NASA is interested in improving their bone density. So this is an animal study where animals were exposed to radiation, and prune was able to prevent this bone loss in comparison to an antioxidant treatment that they were giving them. So again, prune being more effective in these animals. So in another study from NASA, they looked at combined effect of radiation with microgravity. So because another reason that bone loss can happen is lack of gravity. And this is what we see again in astronauts. And when then those both reasons are combined, radiation and microgravity, again in this animal study, they saw a positive effect from prune added to the diet of these animals, and they improved the bone density. Okay, we often see 1 to 1.5% bone mineral density loss per month in astronauts. So they usually do their mission somewhere between 4 to 6 months. So if you remember when we talked about postmenopausal women, we said they have 1 to 1.5% bone loss annually, right? But this is what astronauts are dealing with. They often have 1 to 1.5% bone loss every month, and their mission trips is usually 4 to 6 months. So that's a substantial amount of loss. So of course, finding something that helps them in their diet is important. Another model and group that they are really affected with their bone density are spinal cord injury patients. So to look at some of the numbers, during the acute phase, the start of the after spinal cord injury, patients usually within the first 1 to 2 years have 15 to 25% bone loss per year. So this is really high and substantial amount of bone that they're losing. And then after that, they kind of like slow down on the bone loss, but again, they have somewhere close to 10% bone loss annually after the second year. So again, in this animal model, a spinal cord injury, prune has shown to be effective in terms of improving the bone density. There's no human study that has followed up in this model. And the last model I explained to you is actually the glucocorticoid-induced osteoporosis. And this is one of the most recent studies, animal studies, and most recent prune animal studies that we have seen. And again, another group looked at this study, this model. And why is the glucocorticoid-induced osteoporosis important? Because glucocorticoid is the medication that is commonly used, and is especially for the group that are so affected by that are patients who have organ transplant. What happens is they are on this medication for life. So now they have the risk of losing their bone density. And I personally have had a student at 25 years old who had a heart transplant. And we often think about people who have organ transplant to just being really old people, but this is like person 25 years young that has to live a life ahead of her, and like having lower bone density is not really an option when you are in that age and when you have to all your life consume this medication. So you can see now that when they compare just placebo and 25% dried plum in their diet, or prunes, they improve the bone density, but when they look at the same animal, but after inducing osteoporosis with glucocorticoid medication, still prune in different doses improving the bone density. So this is really encouraging to see that prune is working in many different animal models and hopefully has that application in human studies. We haven't tested all of that in all these different human models, but just knowing that there is still hope, and this might be something that even if people are on medication for their bone, they can still add that to their diet, add prune to their diet and see some effects, is really encouraging. Oops, sorry. So those are the loss we see with glucocorticoid-induced medication. So again, when they start, it's way more rapid, and then it slows down eventually. So to summarize what we talked about, so there are different animal studies in terms of prunes. So we went over young, overectomized, orchidectomized, and aging animal models. We also talked about how radiation and microgravity can cause bone loss, and prune is shown to be effective in mediating those. Spinal cord injury and glucocorticoid-induced osteoporosis model are those all the animal studies that have been so far been tested in terms of prune. In postmenopausal women, we have looked at younger postmenopausal women, which they were within the 1 to 10 years postmenopause, and then women who were more than 10 years postmenopause. So the different studies I presented to you were at different ages, and they all have shown that prune is able to prevent further bone loss in this population. We also looked at the younger women, 18 to 25 years old, and especially the one who were consuming oral contraceptive, or they were taking oral contraceptives, and we have seen positive effect in that population. And in men 50 to 79 years old, it's just a pilot study, but we also have seen improvement in this population when prune is added to their diet. So in general, when we look at the fruit intake in the United States, you know that only 20% of us, sorry, not 25, only 20% of us are consuming the recommended amounts of fruits daily. So definitely adding fruits to our diet is important, and why not part of it be just prunes to make sure that your bone density is protected. So with that, I would like to thank many people who have helped me in this path really and this line of research. This is my advisor who started this research. Of course, I tried so hard to find a picture to include Dr. Elam as well. But you know, that's like my research lab group back then. And you can see probably he was avoiding all the girls, all being in a lab that is, everyone is just a girl. So every time we were taking picture, he's like, how can I get away? And then, of course, a lot of my collaborators, like Dr. Kern and then Dr. Smith, some of her studies I presented to you. So those are really interesting studies that you heard about them. And so many different groups of students in my lab that over years, the past 15 years, have helped me to develop these studies and working on these projects. So I am definitely grateful to them. Also, funding-wise, funding for these studies, either it was for me or for other investigators I presented to you, they mostly were provided by USDA, California Prune Board, and for me, some has been through San Diego State Research Foundation for our studies. With that, I am ready for questions.
I have one question. Thank you so much for that wonderful presentation and calling me out like that. Yeah, I was wondering. I don't think you mentioned it, but have you looked at juices, pummices, for their effects?
Yes, so I didn't present that study. There are really many animal studies when you look at the effect of prune. And not me, but you know, Dr. Rajmandi has looked at the effect of different byproducts of prune, so pumice, prune juice, puree, so many different forms. And among those, still they showed improvements in bone density in animal study, but still prune as a whole was most effective in terms of improving bone density. So maybe there is something that is not translated into those products that we don't see the effect as effective as the whole prune.
Thank you.
Mm-hmm.
So for your studies, what prunes did you use? Like, did you use self-dried plums, or was there a certain brand that you studied?
So it is kind of easy in US to do prune studies because, I mean, you know, I'm from Iran, and in my country we have so many different prunes. But in US, most of the prune that is available to us is actually is California prune. So 98% of the prunes you see in the market is California prunes, and they can be different companies. So it could be Sunsweet, or you know, Sunsweet is the biggest provider of those prunes, but there are different varieties. So even the prune you see in Trader Joe's is the same California prunes, you know. So this is the prune we really use if you want to see how they look like. But yes, in all the animal study and all the human studies so far conducted in the United States, they're all California prunes that they have been used. But that's what mostly you see in the market. There are other kinds sometimes, but it's just very small portion of the market.
2 quick questions. One, it looks like you're still trying to figure out why prunes perform better than other similar vegetables. And you had the nutrient analysis, but it's using old standard textbook nutrition. And I'm curious whether the juice to me is a hint that there are phytochemicals in the skin that don't exist in the skin phytochemicals of apples and some of the fruits. So I'm curious if you've done a phytochemical analysis of the other fruits to see if there's maybe a phytochemical whose effects haven't yet been identified that's actually driving the excess performance of the prunes, is the first question. And the second, I've seen literature and research literature on milk actually being a negative, causing bone loss, whereas the general public's perception is that milk is a good bone food. And of course, there's the urban mythology that Coca-Cola melts bones. And I'm curious what you're aware of in the scientific literature on foods that actually accelerate bone loss rather than healing it, and whether there's any studies with prunes combined with those and what those effects. But anyway, phytochemicals, and what are some of the foods that we should be avoiding for bone loss?
Sure. Thank you. So in terms of analysis of the fruits, no, we have not compared different fruits, chemical analysis to see what really in every fruit is having this effect or is not. Definitely what you pointed out, having more polyphenols in the skin is important. And there's also another animal study that I didn't present here, but they did try to fraction all components of the prune itself, just like, from the phytochemicals, different vitamins, and then they grouped them together, and then they did animal study with every component, and still the whole prune was more effective than when you fraction different components of the prune. In terms of milk, the negative studies that you're saying that I'm aware of are usually the association studies. So it's like sometimes it shows higher consumption of dairy is associated with higher fracture risk, So again, that I don't think is substantial enough to just say milk is not good for your bone. Definitely, if you look at milk component, it has everything that definitely your bone needs. Again, I don't work with milk, but just being aware of the literature of bone health, that's definitely one of most important food you want to have in terms of having high bone density. And in all these prune studies that I presented, we always supplemented our participants with calcium, vitamin D. So if you don't have the calcium, vitamin D, it's really hard to see effect of anything else because that's the base of our bone, really.
So my question is, the plum itself, would you have to consume, 3 times the amount, basically, to get the same concentrated thing, and so that's why prune is so more effective, right?
That's true, yeah. So it's harder to have that amount of plum that you can see the amount of nutrients you're hoping for. But that's also an option. So if someone can take that, because one of the reasons we even try to go to lower amount of prune is like how I see in our clinical studies, it's hard for people to consume large amount of even prunes in the form of dried. So going lower and finding the most effective dose is something that we can definitely benefit from. So yes, if someone can have that amount, that's okay.
And by the way, we advise all the speakers when you receive a question, say, great question.
Oh, sure, sorry. Everybody, so far, great questions. I apologize.
Thank you for your presentation. As I was watching, I was looking to see if you would present any data on osteoclasts concentration in serum. So it seems like prunes have a different mode of activation or inactivation and it's not osteoclasts and estrogen inactivation. So did you look at data for osteoclasts and osteoblasts?
Yes. Great question. So I couldn't really put, as I said, I'm working in this area for the past 15 years on the backside. I'm doing all other kind of research, but this is my passion and I keep working on it. So actually the effect of prune we think is through osteoclast. So I didn't present the bone biomarker data, so you can look at the bone biomarkers that clearly shows there are bone formation marker, osteoblast markers, or bone resorption marker. And most of the studies, we always have seen that prune is decreasing the TRAP5B, which is a bone resorption marker. In addition to that, we also have done cell culture studies. So Originally, the way we did cell culture study was usually extracting again different components of the prune and treating our cells. But once a reviewer had really good comment to me that made me think differently when I was submitting a manuscript, and they were saying that the way you extract these components from the prune is not exactly the same way that will be in your body. So you need to mimic the condition in your body if even you are doing cell culture studies. So I started to do these cell culture studies differently. So I would ask participants to consume the prune, and then we would draw blood from them in interval hours, which we like kind of looked at the literature and seeing when different components of the prune will be released in the blood within like 2, 4, and 8 hours. So we would collect blood from participants, and then we would feed our cells, our osteoblasts and osteoclasts, with this serum collected from human after prune consumption. So again, we have seen actually both cells, osteoblasts and osteoclasts, in vitro models to be responsive to these serum extracts from human. But again, in human studies, in bone biomarkers, when we look at the serum level, osteoclast markers are what we are seeing mostly suppressed. Mm-hmm.
Thank you very much for your amazing presentation. One question, I was thinking why you don't think that one effect of those beneficial is coming from gut microbiota, because maybe something will produce there and that would be the reason of that beneficial.
Excellent question. That is really an important question. And there are actually, I have avoided doing microbiome study as long as I could, but there are other group of, and you can probably guess why, but there are other group of researchers that they have looked at that, and we just looked at most recent study we did with oral contraceptive users. We looked at the microbiome as well. And then, yes, there are some changes. We didn't see substantial changes in prune group in our oral contraceptive users, but it is different because they are already on oral contraceptives, and we already published a paper seeing how oral contraceptives can actually change your microbiome. So that could be, some differences. But the other group that they also did repeat our study, they looked at the microbiome, and yes, you are right. It could be just the change in the microbiome that is making those metabolites more biotransportable. Yes.
Thank you.
Yes.
I was just wondering why there's such a huge reliance on animal studies when we're trying to improve the diets of humans. So are we going to start moving away from that? Because as someone that loves plant-based diet for that reason, for the ethical reason, don't you think it's a little hypocritical for us to be doing what you're saying to the mice and all that stuff to, mimic the human condition when we can, like you said, there's such a big pool of people already that don't take care of themselves. So
correct.
Why is it so hard to get those groups, and is there no funding for that? That's what my question.
Excellent question. And yes, yes, it is. Number one is definitely funding. Doing human study is really expensive. Doing human study with bone is super expensive, because when a lot of human study, we look at 8 weeks, 3 months, 6 months is really long enough a study in human study. But in bone related studies, you really need to continue studies at least 12 months. Even when I did 6 months study was a short term study. So they're really usually expensive, and for a long period of time they go. It is easier to look at mechanistic ways in animal studies than in human studies. It's again, when you do human study, many other factors affects people. For example, in your bone health, your exercise is very important. Your genes are very important. 60% of our bone density is dictated by our genes. So there's a lot of variation that makes it difficult. And that's why really what we see in animal study is way more stronger than what we see in human study. But still, the fact that we translate that and we see that in human study, it's commendable. And I want to tell you that as a student who I have started in cell culture study and animal study, and then continue as I grew up to do human study, it is harder and harder for me to do animal study. So I completely understand. So as long as I can, I stay away from it. And a lot of the research I presented for you, they were not my animal studies. So I hope you understand. It is hard for me too. Yes.
Regarding the increased intake of prunes, prunes have been viewed sometimes as a natural laxative. Mm-hmm. Can you comment briefly on the effect on the digestive system?
Excellent
and
question.
the balance that's needed?
Sorry, what was the last part?
The balance that's needed, because one would think the more prunes, the better.
Correct. I agree with you. So I really enjoy every question you have asked. They are really amazing questions. It's not just because, yeah, no, it is really. No, yeah, and we really do, we are aware of the laxative effect of prune, and that's mostly because the combination of its fiber and its sugar, sorbitol. But to some degree, actually, in our studies, when we look at the older population, this is a benefit. This is something that the older population suffer from. So they actually love having a remedy that not only helping with their bone density, but is also helping with their bowel movement. We do look at bowel movement. Again, I'm a dietitian myself, so I'm interested in that topic. So I always monitor in all our human study the bowel movement, and we have seen, yes, the bowel movement change usually within the first 3 months that they're in the study. More often is like first month really, because your GI get used, your gastrointestinal system get used to the fiber and the food you're consuming. So it's not that constantly it stays the same way. The way we also in human study recommend participants to consume prunes is not to have like all the prunes at the same time. So we ask them to spread it throughout the day and usually have it after food, not on empty stomach, to help with that effect. So you're absolutely right. And the reason that the 100 gram even started is actually that's the highest amount that human can tolerate with least amount of bowel movement changes. So that was like really the highest amount. Mm-hmm.
Last question. Yes.
Yes.
Thank you for presenting this. I do really appreciate. Over here.
Oh, thank you.
Sorry.
Sorry.
I do have a question about how what kind of prunes that you use, not species specifically, but did the kind of prunes, whether they were dried, fermented, or even fresh, did it affect the results of your research, and what results were different than the others, and what was successful? Which of the results were successful? So
we only, in our human studies, or if you saw animal studies, they were freeze-dried powder prune, so that's how it has been added to the food for animal. And sometimes they're in the form of pellet, but a lot of time if you want to mix it with the diet, you can just add the freeze-dried powder to their diet. To their base diet. So in the human studies, we use prune, and they are dried. They are basically just the one that are available in market. So we didn't really made any changes to them, if that makes sense. And I should know better what is the exact process of drying for them, but I really don't know. But I don't think there's fermentation involved. If you have ever had prune, they still are pretty moist, and they are, I'm trying to remember, even I want to say their water content is still like around 60%. So it's like pretty moist when you consume that. But yeah, they're all in the same form, and usually the California prunes is the kind we buy, which is like, as I said, everything that you see in the market in that color.
So we have just 5-second question.
No worries.
Do we know if cooking the prunes would alter the health benefits and the bone effects?
Excellent question. So the nutrients in the prune that at least we think are effective in terms of having this bone health effects are pretty stable. So we actually recommend our participants to cook or even like have it in their milkshake, because they're just like, they get bored for 12 months consuming just prunes as a snack, So we do provide them with recipe, and they can consume it in any forms.
Do we still have time? I think we have 2 more questions. Is it fine if we ask them in like 5 seconds in each? I think
fine.
Dr. Ano and then Elvis, we have like 1 question for each. 5 seconds.
Thank you for your presentation. So the question I have is going back to a previous question, difference between prunes and plums. If you account for the moisture loss, do you think the dehydration effect is maybe increasing polyphenolic compounds and changing?
So the nutrient compounds definitely get concentrated, so you can have less amount. In terms of antioxidant, I know when you compare fresh plum with prunes has higher antioxidant activity. So that's again is a published paper from actually a Japanese group that they looked at the effects. So that's something that again I know, but I don't know more than that.
Yeah, so you briefly mentioned that for animal studies, they use freeze-dried plums, but So for human studies, it's only been plums. You haven't examined freeze-dried yet.
No, and we're not interested in that, again, just because I always look at the food intervention from lens of a dietitian, and I really don't think like freeze-dried powder is what I want people to consume. I want them to enjoy consuming food. So yeah, I've never even thought of like, doing a study with freeze-dried powder for the prune study.
I have one small question for me and Marcus. You think we can regrow our hair if we consume more prunes?
I don't think so, because I think my advisor was in the
No,
same
sir,
shoes.
mine's voluntary. Thank you so much for that wonderful presentation and doing such a great job of answering those questions. Next up, we have a breakout session. You guys can socialize, network. This is from 3:30 to